I've got a really quick video for you here, chiropractors, on how we're helping chiropractors increase patient visit average with newsletters. So if you don't know, my name is Gavin. I'm with Central Health Supply. Basically, we help chiropractors with the business side of things and growing the practice so that they can focus on being doctors. And these are some of the mistakes and then some tips on how to do email newsletters right. According to what we've seen chiropractors get 10x returns from their email newsletters whenever they do them right. So I wanted to go ahead and share some quick tips on how to do that. All right. So first of all, a common mistake that I see is called preaching to the choir, basically. And so a lot of chiropractors will only send out chiropractic related stuff in their newsletters. And this tends to be, like I said, preaching to the choir, because patients, whenever they come in, they're kind of already familiar with chiropractic. And if you've done a good job, you usually teach them, if they're not familiar with chiropractic, then usually you teach them about it in the appointment. So they have a good idea of what it is usually if they come in for it. And so if we only send stuff that's chiropractic related, a lot of times they'll start ignoring it, like, oh yeah, I already know that, whatever. And so they delete the email, they ignore it, basically they don't care, and the email newsletter then has no impact. So in general, the more that we can spread out the variety of content, the more likely it is we are to catch people's attentions, right? So some people might only be interested in stuff like that's, exercise related or supplements, right? Now, some people might be interested in chiropractic related stuff, and so you do sprinkle it in there. But in general, we want to make sure that we're not only sending chiropractic related stuff, because there's more that you can talk about, and thus more that we can use to catch people's attention. And the more that we can catch their attention, the more likely it is that they will, remember to come in and share the word and all that good stuff. So common mistake number 2 is straying too far into general entertainment. And so these are things like only sending things that are, just, I would say, more entertaining and really don't have much to do with chiropractic at all, or health at all. And so they're like sharing funny recipes, or like, here's some things that are going on in the community. These are fine occasionally, I think, but whenever you're only doing them, a lot of times, again, people, it makes it hard to stand out and kind of dilute the brand, because again, at the end of the day, this is a healthcare company. Obviously you can do it however you want, but in general, this is what I've seen, is that it can kind of dilute the brand because it makes it seem a little bit less serious. And it also makes it harder to stand out because now you're competing not with, other chiropractors in the same area, but you're competing with everyone across the entire internet who is in the entertainment space. And so, all of a sudden now you're competing with all of the other newsletters that are in their feed that are entertaining. And there's a lot of brands out there who do that stuff are pretty entertaining. Newsletters, they could go to social media to get entertainment, right? There's just, it kind of puts you in a category where you're in a losing battle because there's so many other competitors. And so I would just say, in general, my advice is to stay away from straying too far into the general entertainment category and stick with the health concept, because you're seen as an authority in there. It keeps you out of the general entertainment stuff, and I think it helps the brand as well. So that would be my recommendation. Of course, obviously, do whatever you want, but this is just what I've seen work well, is not straying too far into general entertainment. And so the recommended strategy from what we've tested, again, we've gotten like 5 to 10x returns on these email newsletters. And this is just the newsletters, by the way. It's not like we're adding other stuff, but we can get into that as well. The strategy is to send a good variety of health related content. So for instance, some things you do is the benefits of certain supplements, joint health tips, exercise tips, all that good stuff. And once per week seems to be the sweet spot for most. Too many times, if you're going over that, people are kind of getting bombarded already. And so the more that you send, I think the more likely it is that people will unsubscribe. Again, it kind of depends on exactly what you're sending. But in general, if we're sending more health related stuff that's kind of heavy with information, people kind of have to digest that over a couple days. And so in general, there have been a lot of like studies and stuff like this and independent tests. In general, if you're sending more information heavy stuff, the sweet spot for something like that is usually anywhere from like 3 to 7 days. So we just kind of recommend going on once per week, because most platforms usually allow once per week anyway at a good price. But beyond that, you usually have to pay more. And so it's just kind of the sweet spot. And then occasional asks. And so what I mean by this is there's this thing called a give to ask ratio, where usually it's 4 to 1 if you want to just remain stable. And so what that basically means is it's actually 3.5 to 1, but we rounded up to 4. Basically what that means is you send 4 helpful emails of health related stuff, gives essentially, where you say, hey, we're giving you something helpful and good info and stuff like that, and then 1 ask. And so as an example, it might be, here's the benefits of this certain supplement. Here's some joint health tips. Here's some exercise tips. Here is, one other thing that you feel like doing. Maybe, here's some immune system tips, something like that, right? And so now we have 4 gives because all of these are helpful to them. And they're, we're not asking them to do anything in any of these emails, just, hey, here's some helpful tips essentially that I thought you would find helpful. That's basically all we're doing. And then we can do the ask email. So the ask could be, hey, could you leave me a review? Hey, could you, refer a friend, come in for another appointment, right? Whatever that is. But if we do too many asks, then people start to ignore it, and it starts to go down. And television and social media and stuff like that have studied this very well. And 3.5 to 1 is the optimal. 3.5 give post to 1 ask post is the optimal ratio for if you're trying to maintain. So if you want to grow, or if you want to give even more goodwill and stuff like that, then give more give posts compared to ask posts, or emails, I suppose, in this case. So that's the recommended strategy. And again, like I said, we've seen 10x returns, and honestly, a lot of times whenever we see these 10x returns, we don't even need to do any ask emails, just the simple reminder of the fact that you exist, and you can put something like an online scheduler, or here's a button to call us, something like that in the email at the very bottom, and that usually also can take care of that. You don't even need to worry about ask posts. So I've got a quick bonus for you as well, which is monthly text. So monthly is the recommended cadence from what we've tested. And so more people tend to get mad and unsubscribe or stuff like that, or annoyed, maybe not mad, and then less, and it tends to be a waste of the platform, because most platforms bill monthly, and so if you do less than that, you're not using essentially all your credits, and a lot of times they don't roll over. And so less than that, and you're usually just kind of a waste of money for the platform. And so, for example, some things that you can send, or shockwave or massage deals, if you have any new modalities or techniques or something like that, you can send those out to people, just kind of announcing like, hey, we've got some new stuff that you could try. Essentially, if you don't know what to send, and a good consistent one is to pull reports from your EHR about the last visit time, and then send something like, hey, name. Obviously, you can change out all of these. Anyway, it'll say, hey, name, just a friendly reminder that's been over time, and this is where you separate it out. And so we do multiple campaigns. So we have one of, it's been over a month, it's been over 3 months, over 6 months, over 12 months, whatever cadence you want to do this for, whatever your EHR allows you to pull. You go ahead and separate all of those, and you say, just a friendly reminder, it's been over, let's just say 1 month since your last appointment with us. If you're interested in scheduling, click the following link to schedule, and then link. And you can also mention stuff like, we help with more with, or we help with more than just back pain, for instance, if that's what you're mostly known for. If you also help with stuff like, let's say joint pain, soft tissue, that kind of stuff, you can mention some of that in there as well. Or a quick announcement of like, hey, we just got shockwave as well, if you, again, just as an example. And then again, just sign off with your name. And if you have a online link, you can put that there. If you do not have that, you can say, give us a call at number, whatever. But we've also seen really good, this adds on top of the 5 to 10x returns that we usually see from the newsletters. This one usually works pretty well. We've seen some people get as high as 30 extra returning patients per month. And so the number of returning patients goes up by 30. They were at, let's say 100, and then all of a sudden they go up to 130. So this can be a really big boost as well. So if you'd like help with this or anything else like it, we just released our new Unlimited Clinic Growth Manager service. So basically what that is 1 monthly fee, and we take care of all of your marketing and clinic growth systems. So basically that means stuff like social media, newsletters like we just talked about, all of this stuff. And it's, again, 1 flat monthly fee. There's no upcharges, nothing like that. And it's also, for most people, significantly cheaper than the cost of a CA. So if that's something you're at least interested in learning about, you can go to centralhealthsupply.com/growth. Again, there's a link in the description as well. And the worst case scenario is you learn some more info that you can use in your practice. That's hardly a bad thing. So again, if you're at least interested in learning more, you can go to centralhealthsupply.com/growth. Again, link is in the top of the description. And either way, I hope this is helpful, and I'll talk to you soon.